Every morning, you brush your teeth and barely glance at it. You use it to taste coffee, to talk, to swallow. But you are ignoring one of the most powerful diagnostic signals your body produces 24 hours a day. You are not looking at your tongue. You are dismissing your body's control panel. Imagine your car has a full dashboard, oil pressure, engine temperature, battery charge, all blinking at you in real time. Now imagine you cover that dashboard with a cloth every morning because it's inconvenient to look at. That is exactly what you do when you skip your tongue. Your tongue is not just a taste organ. It is a living, color-coded map of what is happening inside your liver, your kidneys, your heart, your lungs, and your gut. Right now. In today's video, we are going to decode that map color by color, and by the end you will never look at your tongue the same way again. Let's start with the baseline. Color 1, pink, the green light. A healthy tongue is light to medium pink, slightly moist, with a thin white coating that doesn't dominate the surface. That's it. That is your body saying, everything is flowing. Think of this like a clear highway. Blood is circulating. Qi, the body's vital energy, is moving. Your organs are communicating freely. Nothing is backed up. Nothing is on fire. This is what you are aiming for. Remember it. Because what comes next is where most people live without even knowing it. Color 2, pale or white. Now we move into territory that most people explain away as, I'm just tired. A pale tongue, washed out, almost bloodless in color, is a billboard for one thing: deficiency. Your body does not have enough of something critical. That something is usually blood, or what traditional Chinese medicine calls qi, the animating energy that keeps your organs fed and warm. Here is the physiology. The tongue is one of the most vascularized tissues in your body. It is flooded with tiny capillaries that give it that healthy pink hue. When blood volume drops due to anemia, iron deficiency, or chronic fatigue, those capillaries empty out. The tongue literally fades. In TCM, the lungs are the master distributors of qi. A pale tongue points directly at lung deficiency and blood insufficiency. Think of your lungs like the ventilation system in a building. When they underperform, everything downstream gets less oxygen, less warmth, less energy. If your tongue is pale and you are also cold all the time, exhausted, and your nails are brittle, this is not coincidence. Your body is not failing randomly. It is failing systematically, and your tongue is the first place it shows up. Do not ignore this. Color 3, red or crimson. Now things get urgent. A bright red tongue, deeper than normal pink, sometimes with a glossy, dry surface, signals heat. Not the kind you feel in a sauna. Internal heat, systemic inflammation. And it is telling you exactly which organ is responsible based on where on the tongue the redness appears. Here is the tongue map. The tip of the tongue corresponds to the heart. The sides correspond to the liver and gallbladder. The center reflects the stomach and spleen. The back mirrors the kidneys and bladder. This is not mythology. Modern research has confirmed that microcirculatory changes in specific tongue regions correlate with organ-specific stress markers. A 2019 study in TCM clinical analysis found distinct tongue changes in patients with confirmed cardiovascular, hepatic, and renal conditions. So when the tip of your tongue is red and raw, your heart is under pressure. This is what anxiety looks like on the outside of your body. You might experience insomnia, palpitations, or racing thoughts. That redness is increased blood flow to the tongue tip, driven by elevated cortisol and sympathetic nervous system activation. When the sides of your tongue are red, that is your liver talking. Elevated liver enzymes, chronic stress, or alcohol overload all generate what TCM calls liver fire. Think of the liver as your body's chemical processing plant. When it is overloaded, it generates heat. That heat rises, and it shows up at the edges of your tongue before it ever appears on a blood test. Color 4, yellow. Stop for a moment. Look at your tongue coating, not the body of the tongue itself. If there is a thick, yellow paste sitting on the center of your tongue, something in your gut is deeply out of balance. Yellow coating indicates heat and dampness inside the digestive tract. This is your stomach and spleen signaling inflammation. Clinically, this correlates with bacterial overgrowth, chronic gastritis, and in more serious cases, early-stage liver dysfunction and jaundice. Think of your digestive system like a kitchen. A healthy kitchen smells clean, breaks down ingredients efficiently, and produces no excess waste. Now imagine that kitchen has been running too hot for too long. Grease builds up, surfaces yellow, the ventilation clogs. That thick yellow coating on your tongue is exactly that, the residue of a digestive system that has been under chronic stress, eating processed food, burning through alcohol, or fighting an infection it hasn't told you about yet. The more yellow and thick the coating, the more severe the internal heat. A thin yellow coat means early-stage irritation. A thick, sticky, dark yellow coat means your gut is in active distress. Color 5. Purple or blue. This is the color most people never connect to anything serious. They assume their tongue is just naturally that color. It is not. A purple or bluish-red tongue is a direct indicator of blood stagnation. Blood is not moving the way it should. Circulation is compromised. Here is the science. Blood gets its color from hemoglobin carrying oxygen. Bright red means fully oxygenated. Dark purple-blue means deoxygenated blood is pooling or moving sluggishly. When this shows up on the tongue, it means your cardiovascular system is struggling to return blood efficiently. This links directly to heart function, poor venous return, and in severe cases, hypoxia, insufficient oxygen reaching your tissues. Modern cardiology research supports this. Patients with chronic heart failure, advanced lung disease, and poor peripheral circulation consistently present with darker, more cyanotic tongues. A 2019 cardiovascular study noted tongue cyanosis as an early bedside indicator that precedes more definitive diagnostic findings. Purple tongue is not something to sit with. It is your body saying, the engine is not getting enough air. If you see this combined with shortness of breath, cold fingertips, or chronic chest tightness, call your doctor. Do not wait. Color 6. Black or dark brown. This is the one that shocks people. A black tongue sounds extreme. It looks extreme, but it is telling you something very specific. Your tongue is covered in tiny projections called papillae. Normally, they are small, uniform, and pink. When they grow too long and trap dead cells, food debris, and bacteria, they turn black. This condition is called black hairy tongue, and while it sounds alarming, it is a direct sign of gut and oral microbiome disruption. Think of it this way. Your microbiome is a rainforest, thousands of species of bacteria, fungi, and microorganisms in careful balance. When you take antibiotics, use excessive mouthwash, smoke heavily, or drink large amounts of coffee and tea, you clear-cut that rainforest. The aggressive, fast-growing species take over. They colonize the papillae, and the tongue darkens. In rare cases, a black tongue signals deeper conditions, diabetes, HIV, or long-term radiation therapy affecting oral tissue. But in most cases, it is a metabolic distress signal. Your internal ecosystem is severely imbalanced. The fix begins in the gut, not the mouth. Color 7. The cracked, peeled, or coatless tongue. Now entering the most misunderstood tongue sign of all. A tongue with deep cracks running through it, or one that has almost no coating at all, looking dry and peeled, is not just dehydration in the sense of drink more water. It is kidney and ene deficiency. Your body is running out of its deep foundational fluid reserves. TCM identifies the kidney as the root of ene, the cooling, nourishing, moistening energy that keeps the body from overheating and drying out. When kidney ene depletes, from chronic stress, aging, excessive work, and poor sleep, the tongue loses its coating and cracks. The body is consuming itself to keep going. Modern medicine correlates this with chronic kidney disease markers. Research published in the journal Technology and Healthcare found that 43.5% of patients with eczema and related inflammatory conditions had cracked or pale tongues, pointing to the systemic fluid regulation dysfunction that the kidney governs. A cracked tongue combined with night sweats, lower back ache, and a burning sensation in your feet at night is not aging. It is your kidneys asking for help. You are not broken. You are not just getting older. Your body is communicating with you constantly, in real time, in color, in the most accessible way possible. You are not reading your body. You are ignoring its most visible dashboard. Starting tomorrow morning, before you brush your teeth, before you drink your coffee, look at your tongue for 10 seconds. Note the color. Note the coating. Note the cracks. Your tongue changes every day, because your organs are changing every day. And the sooner you notice a shift, the sooner you can act on it. If you want more of these body signal decoders, like what your nail ridges say about your liver or what your eye whites reveal about your kidneys, let me know in the comments below. I'll see you in the next one.